Would I go chronology wise, main issue and associated problems wise, or problem solution wise? Which kind of paragraphing would I follow here? Chronology, but do I have chronology here? Do I have different dates to write? It is just one single period, 10th March to 12th May, that I have to write, isn't it? So, see, whenever you are writing this kind of letters where the patient, the letter is being written to someone who already knows the patient. And when you are writing the letter to update them, and if you think that the discharge plan incorporates a lot of things, you have so many things to tell them, and there are different reasons for each recommendation. Yes, why are we telling them to monitor blood pressure, or why monitor medication, why lower cholesterol? That is all because they had stroke, so probably in order to prevent stroke in the future. Then, so in such situations, whenever you have to write to someone to update them, okay, and if you have multiple things to tell them, it would be best idea to go problem and solution wise. Because see, whenever you are writing to update someone, you wouldn't have any medical history to write about. Yes, you wouldn't have any social history to write about. So what you can do is you can pick up the main problem for which they were admitted and one or two things related to that. So for example, if I start second paragraph with the treatment that we gave them and medication. So with the same thing, what I can do is I can attach the discharge plan recommendations with the same thing to justify, because whenever I would give them some instructions to follow, I would need to tell them why they need to do those things, right? So what I can do here is, say for example, in the second paragraph, what I would include in the first paragraph is just this left-sided ischemic stroke. I wouldn't write hypertension and dyslipidemia because that was not the reason for admission. That is already there in the past medical history, right? So I would, again, MCA here is not a different diagnosis. So I would write it carefully. Then in the second paragraph, because they were admitted with this problem, what treatment we gave them. Yes. So I can write these points in the second paragraph, and where I wouldn't need to mention all this medication because they have been taking all these medications already. So I would just write that dipyridamole has been added to their regular medication regimen, or they need to take dipyridamole along with their regular medication. And with the same thing, okay, I can advise them, or sorry, I can advise is not the right word, but I can request them to monitor their medication and monitor their blood pressure as well. Because see, it says monitor blood pressure, goal 140/90 or goal less than 140/90. What does this mean? What does it mean?
We can control till means blood pressure did not go
Should
up.
not be more than 140.
Yeah.
90.
So the target blood pressure is less than 140/90. So how will they achieve this target blood pressure?
By monitoring medication.
By monitoring medication, right? So I can write both these points together by ensuring that the patient is taking regular medication. And similarly, it says lower cholesterol. What does this case note mean? Lower cholesterol? Is it lower right now? Does it say it is lower right now? What does this case note mean? Is it trying to say?
No, not right now. We should maintain at that
Yes. Yeah. It says goal for LDL is less than 70 mg per DL because they have dyslipidemia. Okay. And it is their LDL is
180.
180 milligram per DL. In 2015, it is written. We don't know the latest value. Yeah, but here it says that it should be less than. So again, how can we ensure that their cholesterol level is maintained is by medication,
Okay.
right? So this is how you can group the information, problem and solution wise. So what is the problem? That they had stroke, okay? Because of stroke, these medications were given to them. They have been started on certain medication which needs to be continued along with their regular medication. And the nurse has to, or the nurse manager has to ensure that they are taking all their medications regularly so that the target blood pressure and the target cholesterol level can be maintained. Yes. So this is problem solution wise, where when you have multiple issues, so this kind of paragraphing can help you reduce repetition, because otherwise what would happen is every time you would have to repeat the same thing again and again. Okay. So this kind of paragraphing can help you avoid repetition. Now, apart from medication, the other issues that they faced was related to their this
Weakness.
weakness. Yeah, we have more issues related to their weakness, right? Difficulty in dressing, showering. So this points you can add in third paragraph. Similarly, you can pick up some points related to difficulty with mobility from this. Okay? But this kind of paragraphing would only be appropriate when you are writing to update someone and you have multiple issues to discuss. Okay? So every time this kind of paragraphing would not be appropriate, you would have to think logically in that particular situation what kind of paragraphing may work. So there's three types of paragraphings are there. You can choose which one would work for that particular situation. Now, if we include everything related to physiotherapy and here, then again it wouldn't be a major issue to add one more sentence about the speech therapy, right? So we can pick up speech therapy also. We can write in the same paragraph. Okay. Then in the fourth paragraph, we can write about their diet. So BMI is high. That is the reason diet modification is done. So I would include this in a way where I wouldn't say that please note their BMI is high, because they may already know this. BMI wouldn't have increased only when they were in the hospital. In fact, in hospital, they have lost 5 kg weight. It says gradual weight loss of 5 kg. So they have lost weight, but still their BMI is high. So I would say therefore they have been advised to, and because their BMI is high, they are at risk of developing diabetes, right? So with the same thing, I can add diabetes as well. Okay. And then about the depression. Yeah, sorry, I missed one point about diet. It is very, very important to mention what kind of diet is to be taken. Very important. That is where what content is assessing, right? How would they monitor their diet if I have not written what kind of diet is to be taken? That's very, very important. And in one paragraph or in one line, you can write about the social issues that they have been facing.
A neurological consultant.
Now, for neurological consultation, I have two alternatives. one thing I can do is in the second paragraph itself, I can mention this point that although they have, progressed well, they need to continue this medication. So one way of this is I can put it in the second paragraph, or I can write it in the last sentence that they have made good progress and they need to be reviewed on this date. So both the way it could be helpful. You can write it in both the ways. Right? And these portion we are completely going to exclude because it is something that the target reader is already familiar with. I would be taking some, support of depression somewhere without saying that I have to use the sentence in a way where I should not be informing them. I should not say that, please note, since their husband's death, they are depressed. And that is where the genre and style criteria plays an important role. Right? The genre and style is the fifth criteria. What is it assessing? Your ability to use formal language, your ability to modify the language based on the target reader. So I wouldn't say her current medications include enalpril, aspirin, and those things because they already know them. So I could simply say that in addition to their regular medication, they also need to take diparadomol this much, this many days. So that is genre and style. Okay? When I say your regular patient, so that's genre and style because it gives, it is tailored to that particular reader. I have not used general language for them. Similarly, when I say that, as you may know, they are mildly depressed, they need to be screened for the signs of depression and should be encouraged to participate. So, as you may know, when I say, it gives them the idea that I'm aware about the target reader. I know the audience. But if I write, please note, since her husband's death, she is depressed, I would lose mark in genre and style because I couldn't modify my language. I was not supposed to inform them about this. Okay? Similarly, I wouldn't say that, please note, their BMI is high because obviously they know these things, right? And just in 2 months stay in your hospital, their BMI wouldn't have increased. So that is genre and style. So are these 5 evaluation criteria now clear? Purpose, content, conciseness and clarity. Here I'm going to explain you further how to write good summary. Then your ability to group the information and prioritize. So if you see here in the task, what you have done is we grouped the information related to issue, problem and solution, problem and solution. Okay? And we prioritized it because first we need to tell them what happened in the hospital. Okay, what treatment has been given. Medication seems to be the most important thing, then physiotherapy, language therapy, and the diet modification. So the most important things here are to make sure that they take medication, to make sure that their blood pressure is controlled, to make sure that their cholesterol level reduces, okay, and informing them what medications they need to take. So this is all these things will need to be taken care of while you are writing the letter. So now what I'm going to do next is I'll help you understand the conciseness and clarity criteria with the help of summarization. You need 3 skills to be able to summarize well. You should be able to group the information. You should be able to use compound and complex sentences. And you should be able to link the information in a way that helps you to clearly convey the idea. I'll just get the model answer on screen for the first paragraph, first two paragraphs. Is it visible on your screen, the model answer?
Yes, ma'am.
Yes, ma'am.
Yeah. Okay. So can you see here the introduction paragraph? Mrs. Dyer, a resident of your nursing home. So I'm making it clear that I'm not writing about any new patient who was admitted with the diagnosis of left-sided stroke. So I haven't mentioned the middle cerebral artery at all, mainly because I'm writing to the nurse manager who has to mainly, she is not responsible for diagnosing, not too technical person. She mainly needs to tackle her symptoms and make sure that the patient is following the required or the recommended guidelines. Yeah, and if you wanted to include it, the proper sentence formation would become who was admitted with the diagnosis of left-sided ischemic stroke due to occlusion of middle cerebral artery. Due to occlusion of middle cerebral artery is being transferred back into your care today. So see, appropriateness of language. This is what genre and style means. Instead of saying that she is being discharged today, yeah, because here I'm not discharging them, I'm sending the patient back to the nursing home and the same nursing home. That is why I've used transferred back into your care. So
Then when we use discharge, ma'am.
when the patient is going home,
Okay.
yeah, after discharge, if the patient is going home, then you can say she is being discharged today. And if you are sending the patient into nursing home after discharge, then you would say she is being transferred into your care. If you are sending the patient to the same place where they were staying before, then you can say transferred back into your care. Yes. So this is where genre and style plays an important role. Depending on who the target reader is, you should be able to modify your language, and that is why the templates would not work. So if I every time start my letter with I am writing to refer, yeah, here in this case I'm not referring them. Am I referring them? No. I'm just updating them about their own patient. I'm not referring a new patient to them. So that is why we did not start this letter by saying I'm writing to refer. Okay, and this letter summarizes the details of her progress and future care requirements, because I'm also writing about her progress and what is to be done in the future for it. Now look at the second paragraph. Okay. This is one example of how you can summarize information. So I started with initially here, okay, because after admission Mrs. Dyer was treated with tissue plasminogen activator. Here you might have a question, why have I not included the admission date? Again, keeping in the mind that the nursing home people would have sent her to the hospital. So it may not must to write it. If you write it, that is fine. Okay. But it may not be absolutely necessary to say when they were admitted. So that is why I said initially she was treated. This is passive voice, was treated. Yeah, instead of, because I don't know who gave plasminogen activator, so we don't write in OET writing, we don't write those kind of sentences, the doctor treated her. No, because we don't know which doctor treated her. So when you don't know who did that action, you use passive voice, because you don't want to focus on who did it, you want to focus on what was done. So Miss Tyre was treated with tissue plasminogen activator, and then she has been advised to take. So here, instead of using she has been prescribed with or she was prescribed with. I have purposefully used present perfect tense because I want to say that she is also supposed to take it right now as well. Has been advised. Has been advised. Instead of saying she was given. If I say she was given, it may only convey that in the hospital it was given. It would not say anything about it, whether in the future she needs to be given or not. Okay? And accurately mentioning the dosage, frequency, in addition to her regular medications. In addition to her regular medications. So this phrase I can use only and only when the target reader is familiar with the patient's medications. Yeah, and I'm writing to update them. Otherwise, I can't use this because how would they know what are her regular medications otherwise? And then the solution of the problem. Please monitor her compliance with the treatment regimen, the one which we have mentioned above, in order to attain the ideal blood pressure and cholesterol level. Okay. Here, if you don't add these values in the bracket, you can also write one more sentence that her blood pressure should be maintained at 140/90 and the cholesterol level should be reduced to this much. Or you can also write the target blood pressure is this much and the cholesterol level is this much. That is also fine. Okay? So this is probably you can say level A summary. But if you want to write level B, like if you are targeting 7.5, that is level B of OET, in that case, it would be fine if you write one more sentence here instead of writing this in bracket. So that's fine. That's not a problem at all. So does it make sense now? The conciseness and clarity. How can I get conciseness and clarity? Is with the use of compound and complex sentences. So if you can see here, we used this connector here in addition to her regular medication. Then we use a complex sentence here in order to. When you use in order to, it is a complex sentence. In order to is used when you want to give purpose for something. Okay? For example, when I say please, perform an X-ray in order to detect pleural effusion. So what is the purpose of performing X-rays? To detect pleural effusion. So similarly here, why the medication compliance is to be monitored so that the blood pressure and the cholesterol levels can be maintained. So for conciseness and clarity, you need grammatical resources. You should be good at using variety of grammar, active, passive, compound, complex, tenses appropriately so that you are able to clearly convey the meaning. Okay. Now, what I want all of you to do here is okay. Yeah. So what I want all of you to do now is I want you to write the summary for rest of the paragraphs and then submit it to me through the email. Yes, you will need to uh, type it in the Word file and then you have to submit it to the email address. I would just repeat the way in which you need to write. If you need to type in your name first. So if your name is Manali, for example, then you would write which task you are writing. So the task I'm doing right now is classwork test 7. This is how you should name the Word file, and the email address is this. you should send your assignments on this email address, writingcorrection@oetacumen.com. Please make sure that you are typing it in the Word file. The scanned answers will not be acceptable. I would not be able to give you feedback on the scanned answers. So they must be typed once in the Word file, and this is the email address where you need to submit your answers. Yeah. So now you need to write third paragraph, probably about, we can cover all the physiotherapy things in the third paragraph. Okay. Then the diet recommendations, okay, and the depression problem. Alternatively, you can also club the physiotherapy and diet together. That is also fine, because then they would all become associated care requirements. Medication is main, and apart from medication, the physiotherapy, diet, and language therapy. But conciseness would play an important role here because we have a lot of information to be covered. Okay, so now if you have any questions,